for government of Uganda to implement a health supply chain. And broadly, this roadmap seeks to strengthen the capacity of government MDS to plan, finance and effectively manage the national health commodity supply chains vis-a-vis depending on donor funding. Now today in our studios, we have Mr. Moses Mukundane, who is a senior research fellow with ACCORD and is going to help us understand the health supply chain of Uganda and what is entailed in it. Welcome to the show, Mr. Moses.
Thank you very much, Fatia. I'm glad to be here this morning.
When you talk about a senior research fellow, in which area are you doing your research, to be specific?
Basically, my area of specialty in research is health-related research activities, public health, and for that matter, international public health, but broadly, health strengthening systems.
Okay. When you talk about the health supply chain, what is entailed in this? Can you try to break it down for us to understand what the health supply chain is?
Thank you, Fatia. When we talk about health supply chain, is broadly two things: the context of health commodities and then operations of the health commodities supply chain. But here, when it comes to the context of health commodities supply chain, we mean the chain to do with the distribution or the supply of health commodities from the manufacturer through the warehouses to the district and finally to the health facilities up to the last user of these health commodities. Okay. That is health commodities supply chain. But as I said, it also has a component of operations. For this to happen, to have these commodities move from the manufacturer, as I said, up to the last user at health facilities, there are also other operational aspects: the human resources, the finances, the infrastructure, to mention but a few. That is basically what health supply chain is all about.
What are the most important aspects that as Uganda we need to have this health supply chain complete?
Supply chain has a system, just like any other health system. World Health Organization actually prescribes the building blocks for a health system, which are not different from those of health supply chain system. For example, the issue of financing is very important. Leadership and governance is very important. Human resources, or what you call health workforce, very important. Of course, commodities, especially to do with medical products, vaccines, and technologies. And then information sharing and use, and then service delivery. Those are the building blocks of a system which are also relevant to the health supply chain system.
Wow, that's really detailed. Now, when you talk about the health supply chain, what status is Uganda's health supply chain in, and how has the journey been for us to have it in this current status?
Yeah, the status of a health supply chain in Uganda can only be described again using the same building blocks.
Okay.
But broadly, the system is actually, it's a developing system in a developing country. So it means that we have made some strides, but we haven't reached there.
Okay.
And I can pick a few. I can base my my submission on those building blocks.
Okay.
Financing.
Those are the most aspects that are currently lacking in the chain.
I must say, as the country, yes, we have made strides, but we still have several weaknesses and also loopholes in the system, and those can be described through the building blocks that I've just mentioned.
Okay.
I wanted to come to, for example, financing.
Okay.
It is true. Yes, generally, of course, financing of healthcare in this country, definitely, yes, there has been some strides over a decade, but still, remember, there is this Abuja Declaration, which requires all the member states of African Union at least to allocate 15% of their national budget to health care. But I think you know that that allocation, the budget, the national budget allocation to health sector has really stagnated, I must say, sorry to use the word, at around, it is actually average 7 to 8%.
Okay.
And yet the requirement is 15%.
Whoa, that's very low.
Now, this has also an effect on other aspects of the health sector, including the financing of essential medicines and health supplies in this country.
Okay.
It is true. There has been strides, of course the country has made strides in financing the essential medicine and health supplies over time, but still the funding is not sufficient. And I must say, for essential medicine and health supplies in particular, we still largely depend on donors to the extent that approximately 70% of the essential medicines and health supplies in our public health facilities actually are funded by donors. The government of Uganda contributes approximately 30% of that requirement. That's an example of financing, right? But we must appreciate that even that 30%, it is not just a recent phenomenon. No, there has been an increment from 20, 25, and here we are.
At 30%.
At 30%. As we shall talk maybe in subsequent engagements, the 10-year roadmap actually is trying to reverse this trending, this financing architecture of essential medicines. Flip the 30 versus 70 to be for government, and then 30 for the donors,
yes,
respectively, at the end of the 10 years. I am giving you an example of how, the status of the health supply chain system in this country. I just used an example of financing. But there are other also parameters. Human resources.
What do you mean?
The health workforce. For example, the critical human resource positions for the health supply chain in this country is still suboptimal, right? So we still have several critical health supply chain human resource positions that are not approved, and even those that are approved are not even filled, both at national and subnational levels.
Which specific offices?
At the Ministry of Health,
Okay.
the best of my knowledge, there are like 2 or 3 positions. One of them is a principal pharmacist. Another one is, I think, assistant commissioner
In charge of what?
in charge of logistics.
Okay.
Okay, I know there have been some changes, but there are some positions that are actually approved, but they are not filled, and this one has a serious effect on service delivery of health supply chain. At the district level, we need to appreciate. Yes, as I said earlier, some strides have been made, okay, over time, although we haven't reached there. Now, recently, Ministry of Public Service released a new human resource structure for health,
Okay.
for regional referral hospitals, for general hospitals, and the districts. And of much appreciation is that at the district level, there is a newly created position which is critical, and that is district senior pharmacist. This position has not been there.
But you remember
Okay.
government put a ban on new recruits.
That's very true.
Yes.
That's very true. I think the first thing is to have the positions in the structure. Okay? Yes, it is true. There is that structure, a new structure, which has those critical positions as far as any supply chain is concerned. Although the question now is the wage bill. As we talk now, of course, you are right to say that there is a ban on the recruitment, right? Just because, and again, based on the way the economy is faring. But at least we are very optimistic that since we have a structure in place, at some point in time, we know through advocacy, through negotiation, we will have these positions filled. But definitely, that's not all. We still have several other positions in terms of health supply chain, health workforce that we still need so that we can have a fully functioning health supply chain system.
Okay.
And there could be other parameters, but I wanted to use that. So, in brief, in a nutshell, it's a developing health supply chain system in a developing economy.
Country, okay. When you talk about the 10-year roadmap,
Yeah.
does it provide for opportunities for Uganda's whole supply chain to be improved?
Very, very much.
Okay.
Actually, there are several other opportunities that can lead to improvement of our national health supply chain systems. But I wanted to emphasize the 10-year health supply chain roadmap. This roadmap is a national transition strategy of the health supply chain ownership
Okay.
and leadership. And those words are used deliberately.
Ownership.
A national transition strategy of the health supply chain ownership and leadership
Yeah. I
to
get
government of Uganda to increase the local capacity to plan, to finance, and manage health supply chain activities independent of donor support.
Okay.
So the roadmap, in brief, seeks to reverse the financing trend of the health supply chain system,
Okay.
as I said earlier.
Yeah.
Okay, for example, for essential medicines and health supplies, 70% is by donors and 30% is.
So the 10-year wants to change
So-
70% by government and 30% by donors.
Exactly.
Okay.
In the next 10 years,
Okay.
2022 to 2032.
Okay.
Yes. And of course, as we do this, the overall goal is to make sure that there is that self-reliant aspect, okay? A shift from that donor dependency to our own, okay, owned health system by government of Uganda, so that we can ensure the sustainability of development outcomes of our health supply chain system.
So when you look at how the 10-year roadmap talks about the health supply chain, it means that it can't be a one-man's job. Which ministries and departments of government are supposed to be at the center of implementing this roadmap?
Yep. So, this roadmap has 8 thematic areas. And each of thematic areas actually has an MDA, a ministry, a department, an agency that is actually relevant to the implementation of the thematic areas.
Okay.
One of them is health commodities supply chain management. There is human resources for health supply chain. There is information information systems strengthening. We have leadership and governance. There is also financing, okay? So, and others, I mean, including, for example, the storage, the distribution, okay, of the health commodities. So, based on that realization, the development process of the 10-year roadmap employed a principle of one government approach, meaning that looking at those 8 thematic areas with different key players as stakeholders, it necessitated the coming together of those ministries, departments, and agencies that have a critical role in implementing these thematic areas of the roadmap, okay, to maximize resources, to maximize competencies and capacities in unison,
Okay.
to implement this 10-year roadmap.
Have you ever
So,
had a
for
chance-
example, what are those MDS? Definitely, the implementation of the roadmap is coordinated by the Office of the Prime Minister,
Okay, that's okay.
by virtue of its mandate in the government of Uganda, coordinating all government entities in the implementation of government programs. And this one is also part of that. But we also have other ministries. Ministry of Health is very key. Ministry of Local Government is very relevant. Ministry of Public Service is very relevant. Ministry of Energy and Mineral Development, Ministry of ICT and National Guidance, and other agencies, National Planning Authority, National Medical Stores, Joint Medical Store, National Drug Authority, and of recent Ministry of Agriculture, Animal Industry, and Fisheries. So, just trying to work together to implement those thematic areas that are outlined under our 10-year roadmap, but based on the institutional mandates.
Okay. I've had a chance to visit one of the government hospitals, and it's really very rare for one to find their essential medicines. Maybe Panadol. Panadol is always there. And then we usually see stories of medicines getting expired. Why is the loophole, and how can we better this?
There are several contributing factors to the availability or stock out of essential medicines in health supplies. I don't think I would dwell into that so much, but basically they are we can analyze this on two levels. One is the supply side, and another one is the demand side. Supply side is from government. Anyway, from, for example, national warehouses, right? And we have two warehouses. We have national medical stores and joint medical store. Now, there could be challenges in the distribution of these commodities, right? That is now the supply chain. In terms of transport, right? But also availability in the stores or in the manufacturing of those essential medicines that are needed at health facilities. Now, at the health facility level, there are several other issues. One is the ordering. Okay, actually it begins with procurement planning. Every financial year, every health facility is required to draw or to develop a procurement plan for the medicines that are needed at that particular health facility, right? Now, that plan is submitted to NMS to guide the delivery cycles. Okay? So, if the procurement has issues, has loopholes, it means that there is a possibility of having stock out of some of the essential medicines and health supplies. It means that if, for example, a health facility plans to procure medicines that are not actually needed or demanded by the population, okay, it means that once NMS delivers those medicines, they will not be on demand, and eventually they will expire. I'm giving you an example. There are some districts that are used to have the outbreaks of river blindness. Okay? Now, it became like a routine, which is also a weakness in procurement planning. Now, some of the districts that were previously affected by river blindness, okay, they would now procure, okay, the medicines in anticipation of that outbreak again, right? So, but it happens that maybe in that particular year, there is no outbreak.
How about digitalization? Can't it be a solution to these problems?
Yeah, I wanted to come to that. Okay, I wanted to come to that. I wanted to explain the issue of stockouts. Okay. Another issue of stockout is actually ordering. Okay, there is a policy basically that if a health facility does not order for certain commodities, okay, then NMS or GMS should not deliver. But I want to tell you that actually some health facilities do not order. And those that order, sometimes they don't order in time. And yet there are some systems that have been put in place. For example, NMS has what we call customer self-service portal, where each facility should order digitally, okay, and on time. But for some reasons, maybe electricity, maybe internet, some health facilities don't requisition on time. And for that matter, therefore, NMS may not deliver, and yet at the end of the day, you can, a health facility can experience stockouts of some health, of some health commodities.
Have computers been distributed to these hospitals to fast track the digitalization of the health supply system? Actually,
digitalization of health supply chain is one of the key elements of the 10-year health supply chain roadmap. I talked about health information systems. So they are now deliberate efforts by the government of Uganda to digitalize the health supply chain. Now, for digitalization to happen, there are certain enablers.
Yeah.
One of them is hardware. Okay, computers, right?
Yeah.
For you, if you are saying order on time, report on time, you need a computer,
And
right?
to track what you have.
And a computer, for it to serve those functionalities, it needs internet.
Okay.
It needs electricity.
Okay.
But again, it also needs the human resource, okay, to operate it. Okay? So, digitalization efforts are now ongoing. Of course, government of Uganda, including, okay, implementing partners or health development partners. For example, the USAID, through the Uganda Strengthening Supply Chain Systems activity, there are several computers that have been distributed to different health facilities across the country to support that digitalization. But we are also aware of other development partners, for example, Global Fund, UNFPA, that are also in working together to really strengthen the digitalization process by distributing also the number, a good number of computers in different health facilities of different levels of care.
You understand some districts do not have access to electricity, and then internet is still a challenge in Uganda. So how are they going to help those districts? How are they going to help those districts also move at the same pace with these ones that already have electricity and have access to internet? And the cost of internet also, talk about it. Who is going to be paying the bill?
Yeah, thank you very much. True. Actually, the digitalization, the efforts towards digitalizing health supply chain system in this country is hampered, okay, by several aspects. But one of them is electricity connection and the internet connection. True, there are several health facilities in this country which do not have access to electricity, national grid connection, but also internet. So, why under one government approach, we are bringing on board Ministry of ICT, Ministry of Energy, to support the digitalization process. Particularly, Ministry of ICT, working together with the NITA-U. They have come up with a kind of a plan, a roadmap, to provide internet connection to a certain number of health facilities. Remember, we have 6,000 health facilities in this country, both public, PNFPs, and private. So, definitely, in a phased manner, they have identified the number of health facilities to begin with, okay, providing internet, and especially beginning with national referral hospitals, regional referral hospitals, general hospitals, health center first, and then going down to up to health center tools. And the same applies to Ministry of Energy and Mineral Development. They are also supporting this process of digitalization by extending electricity connection to the prioritized health facilities in a bid to support the health supply chain digitalization. For electricity, it's not necessarily connecting health facilities on national grid, but also the efforts of off-grid For example, providing solar energy to some of the health facilities. And by the way, recently, Minister of Health, working together with the USAID, the USAID funded Uganda Strengthening Supply Chain Systems activity, they are implementing an innovation where there is a company called Signalytic.
Okay.
They have offered, they're actually piloting health facility electricity connection using off-grid provision of electricity, basically using solar panels. But that package, it has electricity, it has internet embedded in it, and they're piloting it in the district of in the Yumbe district. The rural and the remote health facilities that don't have access to electricity, to internet, right? And they are using that innovation. They have their equipment, they have their sophisticated machines that actually powering that health facilities, and they have internet, they have power, they are reporting, they are ordering. Those are the, at least some phases or some innovations that are into supporting the international process of the health supply chain.
Apart from that, are there any other interventions that the civil society has geared towards improving the health supply chain?
Definitely, civil society organizations are key stakeholders in the health supply chain. And their major role, one is advocacy. Advocacy, especially in terms of financing, okay, adequate financing of the health supply chain, particularly essential medicines and health supplies. But also, civil society organizations also provide data, real-time data, okay, that is used to advocate, meaning that they have evidence-based advocacy campaigns that are oriented towards improving or financing of the health supply chain in particular, but also the health sector in general.
Okay. You, over the years, you've been at the forefront of advocating for a better health, especially the health supply chain. What are some of the challenges you've encountered as you do this work?
Thank you. Several challenges. I think one of them, the one that stands out is it's about change management. We deal with governments.
I know.
Anyway, government, ministries, departments, and agencies.
That's huge.
But we still have rigid attitudes.
I don't care attitude.
Rigid thoughts, I'm sorry to say. Even when you are bringing about these innovations, even when you are bringing about these good things, even when you are advocating for a noble cause, some people still see you as a person from a project. Not appreciating the content that is actually benefiting all of us. You see, some people tend to forget that I am here speaking as an advocate. Yes, I want to see things move in the space of the health supply chain. But we are doing this not actually for my own benefit as an individual, but for the benefit of this country. Just remember that there is this grandmother, there is this grandfather, there is that child, there is that widow, right? Who is in need of health, who is in need okay, of the essential medicines and health supplies deep down, okay, deep down at, for example, Baharu Health Center 3. I am not there, but there is that person who is not there. So people think that maybe financing, why health supply chain, what is it about? We are talking about medicines management. We are talking about the availability and accessibility of the essential medicines and health supplies, right? Health facilities where those people are actually in need of these essential, not for me as Moses, and not for you as Fatu. But then you can afford to go to a private health facility and pay. But remember, there is that person who is actually looking at the government supplied medicine.
Wow.
So if we don't advocate, if we don't appreciate that grandmother, that grandfather of yours out there is susceptible to suffering. So mindset needs to change, and the broader change management interventions is very crucial. It's one of the challenges people always see. That's how we always do it. That's how we are. But change is a fact of life. We need to start start looking at things, okay, with the wider lens, with a broader thinking, that the things we talk about even affect you as an individual, but also that person who is down there, who is also stuck, that actually it matters. So mindset is one of the biggest challenges that we have, that I personally have experienced in this, especially advocacy and activism work.
Okay.
Of the supply chain.
Mr. Moses, I'll take those as your parting shots. You're not the only one who is struggling with mindset change. You realize government over time has been also advocating for Ugandans to change their mindsets towards certain things in the country. Now, that was really insightful. At least now you understand when we talk about the health supply chain. Mr. Moses has been at the forefront advocating for all Ugandans to have access to medicines and safe medicines, because it's different from delivering the medicines and then the storage is also different.
True.
These medicines are supposed to be safe, and local governments are supposed to procure medicines that are really on demand at that particular time. True. Not just having ARVs medicines, yet there are no people that need these medicines at that time. Thank you for being part of the show. Yeah, my name is Nasali Fatia.
Thank you very much, Fatia, for having me in your studio. Thank you.